Greetings and salutations. Thank you for lending an ear to the Voice of the Times this Sunday, August 29, 2021. For today's editorial, new health warning against ivermectin merits attention. The recent U.S. health warning against using ivermectin to treat COVID-19 should sink into public consciousness. The anti-parasitic drug skyrocketed to notoriety, fueled by conspiracy theories swirling on social media, claiming it to be a secret antidote to the pandemic that has claimed nearly 4.5 million lives worldwide to date. Given the number of deaths that have occurred from the disease, it's perhaps unsurprising that some consumers are looking at unconventional treatments, unapproved or unauthorized by the Food and Drug Administration or FDA. The U.S. agency said recently in a statement, "Though this is understandable, please beware." It added, "The U.S. FDA has approved human-grade ivermectin tablets for some illnesses caused by parasitic worms and head lice." But the statement also said, "Some forms of ivermectin are used on animals to prevent heartworm disease and certain internal and external parasites. It's important to note that these products are different from the ones for people and safe when used as prescribed for animals only." That should not be interpreted as an endorsement of the version of ivermectin allowed for humans, the US FDA explained. Even the levels of ivermectin for approved uses can interact with other medications, such as blood thinners. You can also overdose on ivermectin, which can cause nausea, vomiting, diarrhea, hypotension or low blood pressure, allergic reactions or itching and hives, dizziness, ataxia or problems with balance, seizures, coma, and even death. That is likely why the World Health Organization recommends that ivermectin be used only in clinical trials under doctor's supervision. People should listen. Earlier, Philippine health authorities opted not to hold local clinical trials, which of course would require resources that could be used for something more urgent, perhaps for social amelioration spending or buying vaccines. Instead, they decided to wait for the outcome of the many other clinical trials underway elsewhere in the world. The push to embrace ivermectin centers not only around its supposed efficacy against COVID-19, but also its affordability. But the drug's manufacturer, which has pecuniary interests to push its own product, has come out against using ivermectin to treat COVID-19. In a previous editorial, we quoted from a statement issued by Merck, the maker of ivermectin. Merck, which is known outside North America as MSD or Merck Sharp and Dohme, said on February 4, 2021, "It is important to note that to date, our analysis has identified no scientific basis for a potential therapeutic effect against COVID-19 from preclinical studies, no meaningful evidence for clinical activity or clinical efficacy in patients with COVID-19 disease, and a concerning lack of safety data in the majority of studies." This statement has not been updated since. Merck's statement, which is available on its website, detailed the risks associated with people taking their drug. The statement also read, "We do not believe that the data available support the safety and efficacy of ivermectin beyond the doses and populations indicated in the regulatory agency-approved prescribing information." Now, loud and clear, these warnings corroborate each other. To be fair, clinical trials may reach a different conclusion later. For now, people should adhere to guidelines, which allow ivermectin only when it is prescribed by a physician, who of course monitors patients for any harmful side effects. As the US FDA said, the anxiety is felt worldwide, but health experts have also given simple guidelines for protection. Wear a mask when in company of people outside your household. Wash hands regularly and maintain distance from others. These deserve repeating here because it seems that these measures are not strictly followed, especially in many public places. It seems worthy to mention that COVID-19 is a serious threat, but the disease seems less menacing than other pathogens. The deadlier threat may be misinformation. In spite of the wealth of information available in the digital age, people still fall for false or dubious claims. Here are some simple truths that we can all believe. Get a vaccine shot as soon as possible, and whether you have one already or waiting for one, follow the official guidelines issued by the health authorities. Lastly, think critically. when you hear of any claim regarding COVID-19. And that's the editorial for Sunday, August 29, 2021. For more news and information, get a copy of the Manila Times on print, subscribe to our digital edition, or log on to www.manilatimes.net. Follow us on Twitter, Facebook, and Instagram, and listen to the Voice of the Times.